My name is Amol Nirgudkar. I'm the CEO of Patient Prism. I'm delighted to welcome two of my friends here, Diehl and Varney from DSO Hygiene Excellence. And the question that I'm going to ask you right off the bat in our video series about DSO hygiene is, how do we inspire hygienists to fill your doctor's schedule? How do we move patients from your chair to the doctor's chair? Because that's the most important thing, as we've all known. So Sarah, a quick question. What's the importance of having the patients move from hygienist to doctor?
Yeah, and you're right. That's the ultimate goal, right? Is for patients to get the care they need, whether it's in the hygiene chair and especially in the doctor's chair. So I think having the doctor and the hygienist aligned as to what are patient care guidelines is paramount. Is having that conversation, understanding what is excellence in patient care. The hygienist spend a lot of time with the patient. We have their ear for the better part of an hour. We create a lot of relationships with the patient and a lot of trust. And you're right, 80% of the doctor's treatment does come out of the hygiene chair. So I think the hygienists are positioned in a powerful spot to be able to use your relationship, your care for the patient, your backing of the doctor and the treatment that's recommended, and to get the patients to schedule the care they need with the doctor and fill his schedule, absolutely, or her schedule.
I mean, obviously, because you're spending that much time, you have that much time with the potential customer that allows you to build that relationship and earn the trust of that patient. And knowing that if you can tee it off correctly, then everything else falls in place. And that makes a lot of sense, Sarah. Christine, what is the best protocol for hygienists or to basically present treatment, or should they be presenting treatment in the first place?
Well, I think a thorough examination that the hygienist does by doing the necessary x-rays, the intraoral camera, probing, oral cancer screenings. Like Sarah said, we have a lot of time with our patients. I often use the intraoral camera and I'll take pictures if I see like an old amalgam that's leaking, or on an x-ray, I will kind of highlight if like a bad crown margin or if I see something like that. So when the doctor comes in, he is like alerted to, focus and see what I've shown the patient and kind of look at that as well and see what he thinks the treatment is needed. Or like a patient that maybe had a 3 millimeter here, now has a 4, maybe we need to do some isolated scalings in that area for the patient to get them into health. So I think that, the thorough examination is going to really show you where you need to concentrate or what things the patient may need. Even Invisalign, a lot of times I'll take an intraoral photo of, some crowded teeth. If they're missing a tooth, we talk about implants, all those things kind of in the preheat for the dentist.
So you're kind of almost persuading the patient, or kind of getting them ready for the eventual pitch. And I mean this in a very good way, because at the end of the day, what we're trying to do to the patient is moving that patient from a what they are today to a better health position.
Right.
And part of that is you're not really presenting treatment, but you're kind of getting them ready to be presented by the doctor. Is that the goal?
Yes.
Yeah.
Because again, they trust us and we have the time.
Right.
And when do you do that in the process? Is it, if you divide that 1 hour into, let's say, 3 segments, do you do that kind of throughout the process, or do you do it at the end of the process? What does that perfect handoff look like?
I think kind of throughout the process. I'm fortunate to have my intraoral camera right there. So if I see something, I just pick that up and I take a picture. A lot of times on new patients, I'll kind of do like an entire vision of the mouth, looking at their restorations and their crowns, looking for recession, that kind of thing. Mm-hmm. Obviously, we do the probe readings. Mm-hmm. So that's part of the conversation during the appointment.
Even during the scaling. It looks fine on the x-rays. Didn't show up on a camera, but then as we start scaling, you're noticing like, oh, there's open margin here. And we'll tell the patient, it seems like there's a little bit of softness here. Doctor comes in, we'll have them look at it more closely on your x-ray. You may need to have this filling replaced, or it's a larger filling. You actually may need a crown. Doctor comes in, we'll have them look at that for you. So it just kind of happened but then definitely there's that handoff when the doctor comes in.
Right.
So to summarize, really, how do you get hygienists to fill up the doctor's schedule? How do you move the patient from your chair to the doctor's chair? Is really through a thorough examination and education of the patient in understanding what's going on, so that when the doctor comes in, they already are kind of ready to say, oh, my God, my hygienist educated me, did a thorough examination. Now I'm ready to whatever you say you're going to do. And that's the perfect way.
Yeah.
So hopefully I've summarized that well. Thank you so much for this topic. And we'll continue talking about more topics as we go along. Thank you so much.
Thank you, Amol. Thank you, Amol.